Last Ramadan, one of my patients fainted because he didn't check his sugar at the appropriate time. Many diabetic patients they undergo fasting, but either they do not check their blood sugar at all, but or otherwise they check at the wrong time. Today we'll discuss about how often you need to check your blood sugar if you're a diabetic and if you're observing fast during Ramadan or during Ekadasi in Hindu ritual. So during Ramzan, if when you are observing a prolonged fast, there are lots of changes which takes place because your meal schedule gets changed, your rest and sleep and exercise timing also changes. So because of this altered dietary, exercise and resting stages, your blood sugar fluctuates quite a lot, especially if you're diabetic and on medication. Sometimes it can rise significantly high and sometimes it can fall significantly low, which could be dangerous in either of the occasions. So the multiple studies have shown that if you are observing fast, if you're a diabetic, especially on medication, on insulin, you need to plan your fast accordingly. You need to visit to the doctor well in advance. You should have a proper planning regarding as when to take the meal and how much to take. You should have a proper education regarding diabetic management as well as how to adjust the doses of the medication. But last but not the least, and most importantly, you should know as when to check your blood sugar also, as how frequently you need to check. Because if you are a diabetic, your blood sugar fluctuates significantly, especially if when you are fasting. If you are not a diabetic, even though you are fasting, your blood sugar doesn't change significantly, it remains constant. But if you're a diabetic and if you're observing fast and you are on medications, your blood sugar could be either dangerously high or could be dangerously low. And sometimes it could be life threatening also. And especially very low blood sugar could happen in the late afternoon or early evening, which sometimes goes unrecognized. So that's why regular monitoring of the blood sugars are very, very important. And some of us have this notion that checking the blood sugar breaks the fast. Actually, that is not the truth. If you're checking your blood sugar, it doesn't break your fast. In fact, it is mandatory. In order to fast safely and effectively, you need to check your blood sugar, especially if you're a diabetic and you are on multiple medication and on insulin. So that's why when you need to check your blood sugar, how frequently and when you need to check the blood sugar. So you need to check depending on your level of risk, whether you are low risk or moderate risk or high risk. But on an average, you can check multiple times. You can check before before Sahari, you can check late afternoon, you can check before and after iftari, you can check, and at the bedtime also you can check. And if you are feeling some symptoms, signs and symptoms of hypoglycemia, like you are having some palpitation or shakiness of your hands or palpitation or sweating or giddiness, bit of confusion, then also you should check. And you should break your fast depending on what is your blood sugar reading. If the blood sugar reading comes less than 70, you should break your fast. And at the same time, if the blood sugar reading comes more beyond 300, then also you should break your fast and consult your doctor. Otherwise, it could land up you in trouble. So, check your blood sugar, especially when you're feeling that you might have low blood sugar, like as we have discussed, palpitation or sweating or trembling of your hand or confusion, giddiness. All those things should prompt you to check your blood sugar. So during prolonged fast, it is important to monitor, to change your medicine dose. It is important to plan your meal, but it is also equally important, if not more, to check your blood sugar at a frequent interval, because most of us check the blood sugar before iftari, but most of the time the low blood sugar happens during late afternoon or early evening around 4 to 6 o'clock. So it is important that you check your blood sugar during that time to prevent any significant hypoglycemia or low blood sugar. Because as if you are diabetic, your risk is not the same of developing complication. If you are a diabetic, but if your diabetes is well controlled with diet, or diabetes is well controlled with minimal medicines like metformin or a gliptin group of drugs like sitagliptin or vildagliptin or teneligliptin, then you are in the green zone, because either diet control or metformin control or this gliptin control diabetics, they usually do not have low blood sugar complications. So they are quite safe. They need not check their blood sugar very frequently. Once or twice is fine. But if somebody is on insulin or somebody is on a strong anti-diabetic medication like glimepiride or gliclazide, they are in the borderline to higher zone and they need to check their blood sugar frequently. And if they are taking multiple doses of insulin and if they are having complications of diabetes like diabetic eye complication or heart complication or kidney complications or type 1 diabetics, they are highest category of risk and they should ideally avoid observing fast. But if they want to observe the fast because of religious reasons, then they should have fasting under continuous glucose monitor. A continuous glucose monitor is a device where the device is put on the arm and it usually stays for 2 weeks and it gives you a continuous glucose monitoring. You can check your glucose level continuously for 14 days. After 14 days, you can put in another device. So if you're a type 1 diabetic, if you're taking multiple doses of insulin, if you are having complication of diabetes, like along with diabetes, you are having heart disease, along with diabetes, you are having kidney disease, along with diabetes, you are having eye problem or nerve problem, you need to avoid fasting. But if you want to undergo fasting, basically you need to put in continuous glucose monitoring, and under the guidance of continuous glucose monitoring you can observe the fast. So depending on which group of patients you are, if you are a low risk patients who are controlled with diet or metformin group of drugs or gliptin group of drugs, once or twice in a day you can check the blood sugar, like check it before suhoor or before iftar. But if you are having higher grade of diabetes, if you are taking insulin, if you are having a strong anti-diabetic drug like glimepiride, then you need to check multiple times. You need to check before suhoor, you need to check before and after iftari, you need to check late afternoon, you need to check at bedtime, and you need to check whenever you are not feeling well, because if you are not feeling well, chances are there you might be having low blood sugar and you need to check those. So faith and medicine, faith and health, they can coexist provided that you are smart enough and you manage your fasting schedule smartly. So plan your fasting schedule smartly. You check your blood sugar at frequent interval depending on which category of diabetes you are, whether you are taking only metformin or whether you are taking stronger drugs like glimepiride or stronger drugs like insulin. Depending on that, you should check multiple times. And if the blood sugar is less than 70, you should break your fast, take something so that you prevent blood sugar going dangerously low. But at the same time, if you are checking your blood sugar and the blood sugar is more than 300, that time also you need to break your fast and consult your doctor. Otherwise, complications might arise. So if you like our content, kindly like, share and subscribe to our channel.